Hi, everyone, and thank you for joining today's session. My name is Dr. Swathi Varanasi-Diaz, and I serve as one of the medical advisors for MYOS Corp. Today, we'll be exploring evidence-based approaches to preserving muscle health, particularly in the context of sarcopenia, illness, and recovery. All right, so let's get started. Here's what we're going to cover today. First, we'll look at why preserving muscle is such a critical clinical challenge, especially as patients age or face illness. Next, I'll review the clinical evidence behind Fortetropin, a proprietary fertilized egg yolk powder shown to support muscle health. Then we'll translate this evidence into clinical applications to show how you as healthcare providers can use this tool alongside nutrition and exercise to fortify muscle health in patient care. Sarcopenia is not just inevitable aging. It is a condition. Beginning in our 30s, we see muscle mass decline about 3 to 8% per decade, and this accelerates after age 60. Clinically, sarcopenia leads to reduced mobility, higher fall risk, impaired recovery, and increased metabolic dysfunction. Early intervention matters because once muscle is lost, it's very difficult to fully restore. Muscle health accelerates in three key situations. So, one, there's normal age related decline. Two, there's immobilization due to injury or illness. And three is post surgical catabolism. In each of these, patients lose lean body mass quickly. And this directly impacts recovery, independence, and long term health span. So, why does preserving muscle matter? Muscle is much more than strength. It's metabolically active tissue that supports immune health, regulates glucose, and predicts survival. Patients with higher muscle mass often recover faster from surgery and illness. They maintain independence longer, and they experience fewer complications. As healthcare providers, this is an opportunity to think of muscle as a vital sign. So introducing Fortetropin. Fortetropin is a proprietary fertilized egg yolk powder. Its mechanism of action is twofold. It can reduce myostatin, a negative regulator of muscle growth, and it promotes muscle protein synthesis. Across clinical studies, Fortetropin has demonstrated safety and efficacy in both younger and older populations. So let's dive into the data. So our first study is on the screen here. It's by Sharp and their team from 2016. So the study design included 45 men. It was a 12-week randomized placebo-controlled clinical trial, and the intervention had three groups. So there was one group taking 6.6 grams of Fortetropin, one group taking 19.8 grams of Fortetropin, and one group that was taking a placebo. The endpoints included lean body mass, muscle thickness, strength, and serum myostatin. So what did the study find? The study found that in terms of lean body mass, it had increased in both of the test groups taking Fortetropin. In addition, the muscle thickness also increased in both of the Fortetropin groups. The performance and strength gains were actually observed across all groups, so there was no between group differences, and the serum myostatin levels were reduced in the Fortetropin groups in comparison with placebo. So the key takeaway here is that Fortetropin demonstrated both mechanistic and functional benefit. So this means that there was a decrease in overall myostatin, as well as an increase in muscle size and lean body mass. All right, so our next study on the screen is by Evans and team from 2020. In this case, there were 20 older patients involved in the study. The design was that it was a 21-day randomized placebo-controlled clinical trial. In this case, there were actually only two groups. One was the test group that was taking Fortetropin, 19.8 grams per day, and then the other group was the placebo. In terms of the results, Fortetropin supplementation yielded an average 18% increase in muscle protein synthesis across a number of different protein categories. And so, there actually, in addition to that, there weren't any adverse effects. So one of the key takeaways, or the main key takeaway from this study, is that Fortetropin can enhance muscle protein synthesis in older adults. I also didn't mention before. So these participants, the average age was between 66 to 69 years old. And so, if participants or if patients are taking Fortetropin, this study shows that Fortetropin can actually counteract the anabolic resistance that occurs and potentially can contribute to overall muscle maintenance. All right, here we have our third study. So this is by Lim and team from 2023. In this study, it was a population of 24 young men. They took Fortetropin for the duration of the 6-week randomized placebo-controlled clinical trial. There was a 2-week run-in, followed by a 2-week single-leg immobilization, followed by a 2-week recovery. And you can see the endpoints on the screen: the vastus lateralis cross-sectional area, leg lean mass, the muscle fiber CSA, isometric torque, and circulating myostatin. So the key result here is that plasma myostatin increased in the placebo group, but did not change in the Fortetropin group. So the key takeaway here is that Fortetropin prevented the rise in circulating myostatin. And so this really demonstrates the potential use case of using Fortetropin and its impact on myostatin, really kind of functioning as a myostatin inhibitor. All right, so for clinical application, so from these trials, we see that there are several clinical applications. Fortetropin can support hypertrophy in combination with training. It can enhance muscle protein synthesis, and it can suppress myostatin levels. Together, this makes it relevant for sarcopenia, post-surgical recovery, rehabilitation, chronic illness, and even patients receiving certain therapies in which muscle mass loss is a concern, like GLP-1 therapies. Across all trials, Fortetropin showed that it was safe and well tolerated, with no severe adverse effects reported. All right, so overall key takeaways. So to summarize, muscle loss is common, under-recognized, and clinically significant. Fortetropin demonstrates both mechanistic and functional benefits across populations. Applications of Fortetropin can extend from aging and recovery all the way to chronic illness. And finally, Fortetropin can be considered as a part of a broader muscle health strategy that can include both exercise and nutrition. All right, so here I have a number of references on your screen if you'd like to dive into any of the studies that I talked about, including some other references I think you might find interesting. If you'd like to learn more about, what we talked about today, you can check out myoscorp.com, or you can reach out directly to our Chief Strategy Officer. His email is listed on the screen, and we'd be happy to support you in bringing muscle health solutions like Fortetropin to your practice. Alrighty, thank you so much, and until next time.